Hi, listeners, and welcome to this edition of Health Issues, in which I would like us to discuss about diabetes. Remember, listeners, to subscribe to this channel in order to get notifications as soon as I upload a new video onto this channel. In this session today, I would like us to discuss the basics of diabetes. What is diabetes? Diabetes is a disease condition in which the organ of the body responsible for the production of insulin, which is the pancreas, fails to produce the insulin completely, or the insulin produced is not sufficient or is inefficient to convert excess glucose that is found in the body as an end product of the digestion of carbohydrate into a storage form which is called glycogen. If this failure occurs, then any excess glucose that is produced in the body will prevail in abnormal concentrations and circulate in the body system as such. And in an attempt to struggle to balance this situation or create an equilibrium, as the body mechanism will always tend to do, there is the signs and symptoms of glucose that presents, which may include excessive thirst, excessive need for urination, as well as tiredness or pruritus, which is itchy presentations in the body. When these do occur, please, wherever you are, endeavor to seek medical attention as soon as possible so that an urgent diagnosis can be done or carried out, and to prove if you have got diabetes in order to put in place the appropriate care plan to control the situation. With diabetes efficiently controlled, it is normal and possible to live a healthy life without any problem. So, an early diagnosis and identification of diabetes is crucial for healthy living with diabetes. Diabetes includes two basic types. Type 1, which results as a result of the body, the pancreas, not producing insulin at all. The pancreas is unable to produce the required insulin needed to convert excess glucose to glycogen in the body when it prevails in excess amounts. Type 2 diabetes occurs when the body is unable to produce sufficient amount, or the insulin that is produced is inefficient to effectively convert all excess glucose into the storage form, which is glycogen. This glycogen is stored and is reconverted back to glucose for the body to use in case the body runs down or out of the required glucose in the body. So it is a to and fro process where the body handles excess glucose. So in case diabetes is poorly managed, listeners, it is worth noting some of the adverse effects of it, which may even include sudden and unexplained death resulting from either excess glucose accumulating in the body, which is called hyperglycemia, or an excessive low glucose in the body resulting from abnormal use of the medication or insulin that is being prescribed or used for the management of the diabetes. So the goal of this discussion today is to highlight the importance of effective and efficient quality management of diabetes when you happen to have the condition in order to live a healthy life with this situation. So, take home message includes early identification in case you find any of the strange symptoms or signs of diabetes in you, effective diagnosis, and a quality care plan in place and appropriate management of the diabetes with the appropriate use of the medications in place. Change of lifestyle in case you've developed the condition, such as the types of food that you eat, quantity of foods, and moderations of lifestyle changes. When all these are put together carefully, listeners, we are able to live a healthy life with diabetes. Failure to efficiently control our diabetes, in addition, can also lead to wounds being difficult to heal when we develop them. Therefore, as a diabetic, or like somebody living with diabetes, it is worth preventing any injuries on the body, because by the fact that you are living with diabetes, there is going to be a delay in the healing of wounds in case you develop one. You will also be able to have visual impairment due to diabetes. However, if you have developed diabetes, it is still possible to live a quality life with the condition once the care plan put in place is appropriately implemented, either through the use of insulin and other medications or through dietary controls. So, listeners, I hope this will be helpful in giving you the basics of diabetes. And remember, subscribe and continue to follow me in this channel so we can talk more of the basics of different health situations, as I will be coming up with more and more useful tips about other health issues and further on diabetes in my subsequent sessions. Thank you, and subscribe to this channel, listeners. Bye now.